Terry.
So,
Are we still? See, sometimes we disconnect.
but you have some good response. So, may I give you some more information?
Sure. And I have more.
Well, I love it, and we have a topic that people at Teams that visit.
Yes, that's me. That's me on my left knee. But I've used the So is there one balance?
Yeah, so keep rubbing. You don't actually have to rub, just apply it. And the anti-inflammatories, and also the seed husks, they are rich in seed stem cell precursor. So you have not only all the genetic material which was the plant, but it's shut off so that that's all stuff like I don't want to interrupt you guys, but I want to come and say.
All right, thank you.
Good. Simon, nice to see you this morning. And
Oh, really? He said something I didn't hear.
I am honored to know you. Keep it up there.
Yes.
So you're being
It's not a.
wow.
No, wow. It's not simplifying yeah,
Oh, just because. Oh, the ones. Yeah. Well, you
Exercise this muscle. It's painful the next basically yeah, flexibility.
I'm really interested in that cruise thing you said. I've had that idea for a long time. Together, that distraction. How long is it going for? So I've got a fundraiser. It's January. And I've already committed to that. So they're doing a fundraiser. Nice one. I put it in there. Well, it's anyway.
Exactly. I think that was really going.
Yeah, but I can go.
Yes, good
No, I can go. First one. You want? You ask me? Oh, second one.
I took a look at the traffic. No.
It's right. You need to get here early because it's safe, huh? They got the paper lines out here. Yeah.
That's big. Are you going to Mexico? Are you going to the Mexican trip? Ah,
To start on the 2 weeks.
yeah.
This is my first time here. And my friend Anthony is an artist, and he hasn't come in the last 4 years. I was always busy, and this year it's
She'll be busy, over the Labor Day.
yeah.
Is your family member?
Family, and sometimes usually I do something with the family before we go back to, well, the kids.
You have your car?
Yeah, I
You have your car? I ran out of car and
I can write you an email address.
every time you come. I'm glad you're here.
Yes, he's the one that twisted
Come
my
on,
arm.
twisted your arm and twisted your ankle.
Brutal. He's brutal. No kindness. So we're from British Columbia. Good sir. I know you want me short. Sometimes we knew each other before.
Well, some models.
Yeah, so I understand. But when they- You don't look at it just like you did. That's the kind of people with
I have one, this one is for your adult baby. I have another one. But this one's
Colombia, Canada. Colombia, Canada.
Yeah, there's another here.
West Coast, yeah. I'm going to Seattle right after this.
150 miles.
Oh, okay.
Just go on out.
I go to Vancouver all the time. A friend of mine is there. And then I am doing a seminar in Seattle right after.
That way you can just stick it in your hand.
Right after here. Tonight I'm going there.
Oh, yeah. Yeah, I have something. If you
I have never done that. I haven't been invited. I haven't been invited. Seattle I'm going. You invite me. What? What did you say?
Yes, the level organizing a skip.
Yeah, okay. Come to New York, did you say? I'm in New York.
You're in New York?
I ran out of cars. I have had my friend with me.
You know, I've been very happy with Taiwan. All biodegradable. All biodegradable. With the exception of which one is less?
Oh, yeah.
You broke it. It's meant to.
Broke it. It's vulnerable. You put the matches on.
Yeah, if you're cold.
Ladies and gentlemen, if you please take your seats, we want to get started. I understand that there's a sign on the door somewhere that said 10:30. It's 10, so we may have, so that has put us behind a little bit. We apologize for that. when we get everybody in here, then we'll kind of explain the format. Vern, you have a microphone over there, right? Vern?
Yes.
Why don't you get poised up here right on that corner, because I want you to pass that. Harold, we're almost ready to go. Okay, we'll start. Harold, we're ready to go. Chuck? Good morning, ladies and gentlemen. Welcome to the Doctor Symposium as part of the 42nd Annual Cancer Control Society Convention, Labor Day weekend 2014 at the Sheraton Universal Hotel, Universal City, California. Those of you that come every year know that this is where we give our speakers and other invited professionals an opportunity to talk to each other, stimulate discussion, and then time permitting for you to submit questions. And the format is what we tell our people up here is we allot 15 minutes or so for each speaker. And we ask you to take about 5 to 6 or 7 minutes to develop your theme, your topic, in a provocative way that will stimulate questions and comments from the rest of the professionals that are up here. What I'm going to do right now is I'm going to ask each speaker to introduce himself and in 2 or 3 words, primary practice or field of expertise, where you're located, and then not your address, just the city and state, and then pass it on to the next one. We would like to get everyone up here on record so that the NSA data bank in Utah will have all of us together. And there is strength in numbers. So let me start with you.
So do I start? Bradford Weeks. I was initially a psychiatrist and neurologist. I'm on Whidbey Island off the coast of Seattle, and my practice evolved into psychoneuroimmunology, cancer treatments, and such.
Right here. I'm Dr. Nick Delgado. I've lived in California all my life. Just got back from Maui night before last. And, you know, we're blessed to live here. I'm just impressed by how we exist in the presence of toxins and, you know, how we survive a lifetime of eating foods that really are inappropriate for humans. I wonder how we get by without enough exercise. So these are the things that I'm going to share with you.
Excellent. Dr. Dan Newsom out of Boise, Idaho. I'm just glad to be here. This is really cool. I've never done anything like this. Spent the last 10 years stuck in a lab in a clinic or in a classroom, so it's kind of fun to be out in the public again. Boise, Idaho. I'm Dr. Adiel Telora from Minneapolis, Israel, and I have centers around the country and in other countries, doing different things within functional medicine, but mostly focusing for the purpose of this meeting on skin and skin cancer, elimination of skin lesions of all types without surgery and without scars and without pain, so that nobody should have skin lesions which could develop into something bad and which could also be a source of imbalance and result of imbalance or pathology.
I'm Archie Scott from Los Angeles. And my expertise is MSO. I've been a consultant in clinics from the United States and Mexico for 40 years.
In the microphone at the mouth, please, Frank.
My name is Dr. Chandel. I'm from Hollywood, Florida. From the New Florida, as we say that, there's not as much corruption as it is here. I'm doing the cancer profile and the longevity profile, and I will talk about it in a little bit.
Good morning, I'm Dr. Joyce Johnson from San Diego. I specialize in hematology as the nutritional blueprint for getting well, and that's it.
William Eidelman. I have a practice down the road here in the heart of Hollywood. I'm a consultant in alternative medicine, and I work with different sort of energy medicines and kind of discovered a cure for cigarette addiction, among other things.
Hold it closer. Yeah. I'm Peter Starr, and I'm a television and documentary film producer. 10 years a prostate cancer survivor without surgery, drugs, and radiation. Recently completed a documentary called that, a 3-DVD disc, which is now in distribution. I specialize in coaching men with prostate cancer diseases and prostate cancer decisions. I put together a group of doctors that we refer people to, and a group of laboratories where we can send people for tests that conventional oncologists or urologists know nothing about. We operate in West Los Angeles. Thank you.
My name is Martin Blank. I'm new to these kinds of meetings. I'm an academic at Columbia University, and I've been interested in biology and the function of cells in electromagnetic fields. Electromagnetic fields have not received very much play, but the fact is they're getting more and more interesting as people find that they're correlating with a lot of disease, including cancer. In fact, cancer is the one that mainly hits the headlines.
Thank you.
So the camera is.
Hello, I'm Dr. Kazuko Tatsumura. I am from the citizen of the world. I live everywhere, all over the place. And I live in Tokyo and New York. But a lot of time out of the country. I am involved with developing the far infrared, precision far infrared on-net therapy, which is a comfortable heat therapy. So I hope in a few years this will take over many of the problems. And we are doing a lot of things interesting. Thank you.
Stand over here so
people can see you.
Hi, good morning. I'm Tony Jimenez, medical doctor, founder and director of Hope for Cancer Institute in Tijuana, Mexico. We have been working in cancer for 25 years in the integrated holistic fashion.
Simon Yu. I'm from St. Louis, Missouri. I'm an internist. Practicing integrative medicine. I've been in the military as a U.S. Army Reserve for 25 years and have some unique experience treating parasite. And I've noticed when I treat some of the parasite problems, sometimes chronic fatigue, asthma, fibromyalgia goes away, and sometimes even tumor disappears. I wrote that book as a book called Accidental Cure. So I'll talk about parasite.
Thank you very much. Dr. Pai.
My name is Dr. Pai. I'm an integrative medicine specialist physician specializing in treating inflammatory diseases in Colorado, Mexico.
Very good. Thank you very much. And ladies and gentlemen, once again, thank you very much for being here. And just to review the format, each presenter will take 5, 6, 7 minutes to develop his primary theme in a provocative way to stimulate questions and discussions up here. Time permitting, the those of you in the audience, raise your hand and we'll get a microphone to you. To start this morning, the schedule will be very tight today because we do have a lot of people that we need to speak, and so we will be announcing the order, but when we call you, please come up. And we're going to start with Brad Weeks. Dr. Brad Weeks, thank you for being here.
All right, good morning, good morning. I'd like to start these talks by making a phone call to the President of the United States, or not, but these are very important devices. I salute Dr. Blank for being here to teach us about electromagnetic toxicity. Anything you can do to not put a cell phone up to your head is very wise. In the acceptance of using a cell phone, in the agreement for the iPhone 4, it says you agree never to have it on and closer than 5/8 of an inch to your body. How do you turn it on? Right? So we have to be very careful of our conveniences in modern nature. So this is just a reminder that if you're pregnant, unlike my recent client, don't put the iPad on your belly and watch movies for 9 months, because your child will have a good chance of having neuroblastoma when he or she is born. These are dangerous devices. Scientists that I think we know would rather give their child a running chainsaw to play with than a cell phone. Very dangerous, these devices. And I say that as a lead-in to the fact that since we're dealing with cancer, I like to think about this pretty simplistically. Reduce the toxins, replenish what the body is deficient in, and then our role as teachers, docere, doctor, to lead or teach, is to inspire, to educate and inspire. Bernie Siegel, 30 years ago said there's no such thing as false hope. That's correct, I believe. So, to be provocative this morning for my colleagues, I will simply say that all of our extraordinary technologies, remedies, approaches are really subservient to the magic of the real miracle worker, which is the human body. If we're not aligning with what the body is trying to do in a health way, we're not helping. And of course, xeno or foreign substances, patentable substances, substances that are not natural to the body, might give you a pharmaceutical, might give you a short-term benefit, but it's not really the long-term answer. So I tell my patients there's no such thing as junk food. There's food and there's junk. Even though the junk is edible, it might taste good, it's not food. It's not doing what food does. Sleep, most of the sleep medications on the market disrupt sleep architecture. That means you're horizontal, you're unconscious, and you're amnestic, but you do not get sleep. Sleep is a well-defined neurophysiologic process. Stage 1, 2, 3, 4 REM, wake up, 1, 2, 3, 4 REM. If you just get stage 1 and 2, like most of the medications give you on the market today, you're not getting the stage 3 and 4 deep restorative sleep to set up for cancer. So replenish what the person is deficient in. Sleep deprivation, not enough water, and so forth. Detoxify, and then inspire. Now, the last 6 years, although I started out using a lot of venoms, honeybee venom, I founded the American Hypnotherapy Society about 30 years ago. Bee venom is a tremendous immunostimulant. I've worked into other ways of stimulating immune processes, and we now are focusing, as regards our cancer patients, on cancer stem cells. If you have any doubt about this, Google cancer stem cell. I'm not talking about the stem cells that are injected to make you look better or make your heart work better. I'm talking about very dangerous aspects of the tumor. The tumor as a mass, less than 1% of those cells are cancer stem cells. Those are the only cells that can metastasize. Most of us agree that tumors are not that dangerous, or primary tumor, not that dangerous. It's the metastatic disease which kills us, and it's the treatments conventional doctors give to treat the metastatic disease which kills us. The primary tumor, left alone, is less dangerous, but you have to stop the metastatic process. I talked earlier this weekend on inflammation, and the take-home message was that there's two types. There's chronic inflammation, which is immunosuppressive, and there's acute inflammation, which is stimulating to the immune system. We did this with bee venom over the years. You have to be able to use B-Venom without analgesics to get the pain. Acute pain is an immune stimulant. Chronic pain is an immune suppressant. So what I want to share with my colleagues today is that despite all of our wonderful remedies, I want to remind us that it's really the medical treatment is subservient to the wisdom of the body. We need to work with the body. And along those lines, we need cancer stem cell treatments. And those are anti-inflammatories. Max Wicha, W-I-C-H-A, Google Max Wicha, distinguished professor of oncology, University of Michigan, one of the first strong voices saying chemotherapy and radiation make your cancer worse. Professor Max Wicha, there's not an alternative bone in his body. He's a tremendous scientist. His student, Max Dean at Stanford, agrees the cancer stem cell has to be the target, not the tumor. So if we're all focusing on tumors, Daniel Haber down at Mass General Hospital, where I did research years ago, says shrinking the tumor does not correlate to longevity. So don't focus on the tumor, focus on that which metastasizes, that which is dangerous, cancer stem cells. Now, my foundation of knowledge really comes from Rudolf Steiner's work in anthroposophy. There's a wonderful quote: the inflammation found around the tumor is always of a chronic nature and arises not primarily, but as an insufficient reactive attempt by the organism to reincorporate and be whole. So pay attention to chronic inflammation. That is immune suppressant. The other thing that, that Rudolf Steiner talks about, and I went through these slides fast, so I want to just read it. It says, the approach we've described here makes it clear why chronic diseases can often be healed only after the process has been activated. Hahnemann, the great homeopath, says you cannot cure a chronic disease. What you can do is make it acute, and then you can cure it. Beautiful poetry in the form of medicine. So Steiner says it's the art of the physician to reawaken the interest of the organism in this chronic, apathetic process. So I just wanted to say that it's an honor to be here. Frank, thank you for organizing this. I want to just talk with us today in the time remaining on how we can get away from trying to treat the tumor and treat the cancer stem cells, and how we can incorporate the wisdom of the body through giving nourishment. Anti-inflammatories are tremendously beneficial as long as they're whole foods. Because what I use is a seed-based product, whole, organic, non-GMO seeds, not an extract, not an aspect of the product, the whole product. And we found that, like B-Venom, has some of the world's most powerful anti-inflammatories in it, something called melatonin, 100 times more powerful than cortisol as an anti-inflammatory. But what happens when you take the bee sting? You get inflamed. How can one substance have both the inflammation and the anti-inflammation? That's what nature creates. If we don't screw it up and try to extract the active ingredient, we get the yin and the yang together. So whole food diets and things like seeds, which I'm a great fan of, as long as you're eating the husk. So we have a discussion.
Thank you. Well, here, question, comment?
Do you find that soaking, germinating the nuts and seeds is essential to reducing some of the harmful toxins that seeds and nuts?
Yeah, the question is about soaking. So the best way to eat seeds, I think, is to eat the raw, organic, non-GMO seeds, because the seeds, it's always in the fatty substances that the organism collects toxins. Don't eat the belly of the tuna unless you have some good protection. That's where the mercury is. So the seeds are the repository of toxins if it's not organic. So the other thing about phytic acid and so forth, the best way to eat seeds is to buy organic, non-GMO, raw, unradiated, and then put them in the freezer. And then when you freeze them, you can then grind them. Because a ground seed will grind into a fine powder instead of a mucky, gooey substance. And then it can be soaked, it can be added to foods or whatever. But the way most people eat seeds is also beneficial. I take some seeds, I put them in a glass jar, not a plastic jar, a glass jar of water, let them soak for a day or two, and as you're suggesting, that takes care of some of the phytic acid issues and allows the enzymes to activate. But eattheseeds.com, eattheseeds.com goes into your seed. That is nature's VIP lounge. You are eating the most concentrated nutrition on Earth if you're eating seeds. Organic, so you don't get the toxins, and it'll help the body fight the cancer.